You're listening to the Jōrni Podcast. Stem cells are already changing the game for pain, injury, and recovery. But what are the new frontiers of regenerative healing? Stay tuned for an inside look in today's episode. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we explore the groundbreaking world of regenerative medicine and the extraordinary potential of stem cells in healing and anti-aging. Our guest shares his deep expertise as a neurological surgeon, offering a fascinating look into how stem cell therapies can transform the way we approach injuries, pain, and overall longevity. Dr. Jeff Gross graduated from the University of California, Berkeley, with a degree in biochemistry and molecular cell biology. He earned his Doctor of Medicine in 1992 from the George Washington University School of Medicine. After graduating, he undertook a residency in neurological surgery at the University of California, Irvine Medical Center until 1997. He then pursued a fellowship in spinal biomechanics at the University of New Mexico until 1999. Licensed in California and Nevada, Dr. Gross has spine practices in Orange County and Henderson, Nevada. A trained neurological surgeon, he specializes in athletic injuries and spine procedures and offers longevity and biohacking consultations. He is certified by the American Board of Neurological Surgery and is a member of several prestigious surgical societies. Since 2020, Top Doctor recognized Dr. Gross as a leading neurological surgeon. He also received HealthTap's 2022 Top Doctor Award as a top neurological surgeon in the U.S. Dr. Gross founded ReCELLebrate, focusing on anti-aging and regenerative medicine. The mission for ReCELLebrate emphasizes offering modern biochemical treatments and considering surgery as a last resort. Let's meet Dr. Jeff Gross. Hi, Dr. Jeff. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because we are going to be talking about stem cells. And for those listeners who have not heard much about stem cells or don't know very much about it, myself included, I am excited to explore this topic with you. And I'm so glad that you're joining me today. Welcome to the podcast.
Thank you so much for having me. It's my pleasure and honor to join you and your audience and share a little bit. And hopefully, if we just help one person, then it'll all be worth it.
Absolutely. I feel like there are not many things that come up, even in the news or on the socials today, that don't involve something about stem cells. So this has me really curious. And I'm very glad that you'll be sharing some of your insights and wisdom with us on that. To start us off, Dr. Jeff, would you like to share a little bit about yourself, maybe some parts of your journey or your story that connect up with what you do today, and share with our listeners what it is that you do today?
Thank you so much for that. I practice traditional medicine here in the US. We call it the sick care system, right? Reacting to problems instead of preventing them or getting to their root cause. Because that's how I was trained. And for many years, I did that. I'm a neurosurgeon by training. I have a fellowship in spinal surgery. I cared for many people with spinal problems, neck and back problems, disc issues, injuries, pinched nerves, things like this. And it was my patients who sort of gave me the nudge, or many nudges, to open my mind, or I say reopen it, into looking into regenerative medicine, which is the field where stem cells are involved. This comes from them saying, hey, doc, I've got this back pain, I've got neck pain. You've recommended I try physiotherapy and rest and this and an injection here or there. And yeah, that stuff was okay, worked a little bit, but I'm still hurting, but I'm not ready for surgery. I said, good, because I didn't want to have to take you there. And, chance favors the prepared mind. And luckily, I have background and education in my undergraduate days a million years ago in molecular biology and biochemistry. So that's the field where stem cells are relevant. And I said, you know what? I'm going to stop going to these annual neurosurgery meetings where a bunch of stuffy guys in bow ties pat themselves on the back for doing the same old thing for decades and decades. So I stopped drinking the Kool-Aid, as we say here, and I began re-educating and retraining. And I saw that a lot had happened. And there's a lot of great clinical and basic science publications, textbooks, journal articles, workshops, conferences, organizations. And I started going to those instead. And I retrained and re-educated with the goal of adding stem cell-based medicine as an option for my patients to help keep them out of surgery. Well, that was about 7 years ago. And since then, it has blossomed into so much more. Petra, I'm doing not only spine cases, but we treat joints, other structural parts of the body. We do intravenous health for inflamed type problems. We do preventative health, or people come in for anti-aging and longevity sort of approaches. Some of them, we call it biohacking, which is fun, and just so much more. We also have some specialty applications. So maybe we'll dive into that a little.
Yeah, thank you so much for sharing all that. And I love your enthusiasm on this because we do a lot of sick care and often not very well. So I love the fact that you're taking a little bit of a different approach here. And tell us some more about what stem cells actually are. I have a feeling we all know they come out of or from the body somehow, but what are stem cells and why are they so special when we are actually talking about healing, health, and longevity? What makes these things so special?
Yeah, so a little basics on stem cell medicine, stem cell science is this. We started out as a fertilized egg, and then we became 2 cells and 4 cells, et cetera, 2 to the n for those mathematic nerds like me. And we became an embryo, and the embryo becomes a fetus, and the fetus eventually becomes a baby that's born, and the baby has to grow and develop. And all that's done with stem cells. And you start out as a stem cell, the stem cells create you. They have sort of more potential than our regular cells. Our regular cells are sort of the end unit cells of our body. They have usually one specific function, like a bone cell is structural. A liver cell has to help filter the blood system, things like that. But these cells can help divide and replace cells. And even when we're adults, we maintain stem cells in our body, a bank of them. The vast majority are in our bone marrow. Some are in our fat and other places in the body, but the good ones are really stored in the marrow, and they're called upon when necessary. They can be released at certain times, although there are always some being released. And every time we need to heal or repair or recover or replace, those stem cells are helping us. And you think about it, we're constantly shedding our skin cells and getting new ones. We're constantly replacing liver cells, things like that. So this is an ongoing process. However, as we age, as we're exposed to a world of inflammatory problems like toxins, pesticides, preservatives, especially here in the Western Hemisphere, electromagnetic fields, neurostress, psychological stress, all these things that are pro-inflammatory are eating away and degenerating our cells and their function, including our stem cells. So we become less useful at using our own stem cells with age and inflammation. Age really being a manifestation of accumulating way too much chronic inflammation. Someone used the word inflammaging. It's a great word because the faster you collect inflammation over time, the faster you age at the cellular level. We now can learn from that the great things that stem cells can do for helping our body repair and tap back into that as a healing strategy or a treatment strategy. And that's what regenerative medicine means. It's going back into and borrowing some of those stem cells or the signaling molecules and other messages from stem cells that really are doing the work. We can divide into that later if you like, and use those to help someone repair something that they can't do on their own or they can't do fast enough or adequately. That's the strategy. That's the hack.
I love that. It sounds like there are actually many applications beyond maybe what we think of helping with surgery or healing after the fact, but actually preventatively using these to have better health and a better quality of life. If they're in the bone marrow, how do we get these stem cells out so that we can actually use them for treatment? That sounds a little bit scary on how we would extract these from the body. What can our listeners expect if they wanting to try this? How does this come out of the body?
Well, listen, there are options. Let's go over the options. The source for the longest time was really to put a needle into your bone marrow, which is not wonderfully pleasant, and extract some bone marrow. And then through a process of separating out some of the non-stem cells and what have you, there's some lab work to be done. You can extract out the stem cells and then reconcentrate them in a certain area of your body where you need them more. And that can work. It is a bit of a chore to do and receive. They could also be taken out of fat, although I don't love the fat source necessarily because fat can have an inflammatory burden. And there are also issues with taking them from the bloodstream, very difficult. The best source is a donated source from a mother who just delivered her baby. Congratulations. That was a great C-section. You'll barely have a scar. But by the way, instead of throwing out your placenta, your umbilical cord, your amniotic fluid, that trash is now treasure. And that, in the right setting, in a clean, tested sense, is the easiest, most active, unadulterated, naive stem cell and stem cell messages that you can have. I prefer that. It's a lot easier than sticking a needle in someone's bone. Since there's really no significant risk of rejection of stem cells, they're immunoprivileged. The immune system says, come on in. It's like having the golden visa there where you live. You can go to any country in Europe. They get to come on in. They don't have a lot of markers on the surface of their cells to identify them as a certain cell type or coming from a certain person. So they usually don't have any issues with that.
That's really interesting that we can use other people's stem cells. Wow. I guess that opens the door to actually do this even when it might not be a great option for you yourself to harvest them. For example, if you haven't just given birth or anything like that. So that is fascinating. Now, you touched a little bit on that we can locate these cells to where they need to go. So in a sense, how does that work then when we have these stem cells that somebody has generously donated or we have purchased, I imagine, and how do they know what exactly we expect them to do once we settle them to where they need to go?
Well, stem cells send a message to our cells. And at the end of the day, all of these regenerative treatments require our cells to do the work. But our cells are, like I said, exposed to the world. They're cranky, they're inflamed. They need to be re-educated and beat back into shape. And that comes from this influence from the message from a stem cell, which takes our inflamed machinery of our cells and switches it to an anti-inflamed, even for a period of time. And that anti-inflamed set of activities in a cell, or what we call cellular metabolism, puts that cell in its optimal mode where it can do what it's designed to do, whether it's a skin cell or a liver cell or a brain cell or a cell that makes cartilage to help a joint or a spine. Those cells are now not bothered by being in defense mode, this pro-inflammatory mode. The factory can stop making war machines and can switch to peacetime and make dishwashers and washing machines and automobiles and fun, good stuff that we need. So that's really what's happening. That message, the stem cell doesn't do that. It gives the message to our cells through two different mechanisms. One is through small peptides and proteins, which is sort of a local hormone response, or we call a paracrine response, or a chemokine or a cytokine response. Now, cytokine has a bad connotation after the COVID pandemic, the cytokine storm. Cytokines can be pro-inflammatory or anti-inflammatory. Of course, healthy stem cells give off an anti-inflammatory message. And they can also do it through small bubbles of information. I say small, and you're saying, but Jeff, cells are small. What are you talking about? So we're talking about cells making even smaller message bubbles called extracellular vesicles. And these meaning small bubbles off the cell, which our cells then take in through a process, if you remember your high school biology of endocytosis. And there's no quiz after this podcast. So you do not need to take notes. And our cells then take in these things. And in there are peptides and cell messaging information and microRNAs that influence what proteins and peptides that cell is going to start making. It's sort of a set of instructions. So it's a new blueprint for what's going on. It doesn't change the genes. It just changes what genes we tap into and want to call upon. For fun, we call those extracellular vesicles exosomes. EXOSOMES, and that really is the business end of stem cells. So when we talk about stem cells, we're really talking about stem cell derived messaging through exosomes and peptides.
Wow. I like the idea that we can actually send these kind of messages and help ourselves come back to a place of, if we feel all this information, this reaction to stress, to pesticides, to toxins that we're constantly bombarded with, to return to this innate state of health in places so that we can actually enjoy life a lot more. We can be healthy. We can have less pain. We can sleep better. We can have maybe, does stem cells work with chronic illnesses as well? Kind of wondering, what are some of the more exciting applications that you're finding that you're working with in this stem cell field at the moment?
Yeah, I mean, anything that has an inflammatory component. So most diseases of aging have an inflammatory component. Most autoimmune problems are hyperinflamed, right? Too much immune system going on. Some infections have a long chronic inflammatory component like COVID, like Lyme's disease, things like this. So that's the genre of things that really responds nicely on a general basis to regenerative medicine applications. And I also, being a structural spine guy, remember my background, I do a lot of spine and joint work, and we have some wonderful results. And I know you told me before we got on the podcast, you're in Europe, and a lot of the research we follow and have emulated comes from Europe. We in the US are behind the times. So Europe and Asia are way ahead. So most of the work we do comes from clinical follow-up studies. For example, I have to tip my hat to Professor Herngu in University of Paris East, an orthopedic surgeon who we follow his joint protocols. He injects the subchondral bone. That's where the cells are that make cartilage. And when they're cranky and inflamed as part of a process called osteoarthritis, cartilage degeneration, bone on bone, we then re-stimulate those cells to get back to work and making new cartilage proteins and lubricating the cartilage and maintaining the cartilage. And we are seeing clinical results that go along with it, just as he has published.
Wow. It sounds to me that this is something that works for a time, or is this a sort of permanent solution? It feels like we have to keep doing this. Like, for example, if we have osteoarthritis or we have joint issues and this needs to be done, is this something that then needs to be done regularly to keep building that?
It depends on the issue we're trying to help. For example, if you have an old skiing injury to your knee and at a young age, like you are, you have advanced, or we'll call it accelerated wear and tear of your knee, and you have symptoms at an earlier age on one of your knees, we may help that knee catch back up to where it should be at this age, where it's not bothering you. Does that mean 20 or 30 years from now, when you have some additional usual wear and tear that you've accumulated, you may start to have some knee problems again, and we may see you again? We might. But the literature, I mean, Dr. Herngu has published on these 15-year follow-up injecting the bone edge that over 82% of those patients are still not needing knee surgery, knee replacement surgery at the 15-year mark. I'm hoping he publishes his 20-year follow-up shortly.
It sounds like it's not completely non-invasive, but a very good sort of alternative to considering if we're saying knee replacement, hip replacement, back surgery. Those are major invasive procedures. Sounds like a very good step before it gets to that. Now, why isn't this much more well-known or much more mainstream? Are there different factors that factor into the safety of it, the cost of it? What are some of the reasons behind why this is not more mainstream?
Well, it's still relatively new, even though it's been around for 20 plus years. It isn't available in all places. There are many myths. People think there are babies being harvested or fetuses being harvested for this, or people think it's cost prohibitive. in the big picture, if you look at the cost of a knee replacement, the missed work, the pain, the risks, the recovery, the physiotherapy, this is much different. You really don't need physiotherapy after an injection. So we want people right back on their joints using them. And because the different options as to what we deliver, instead of just stem cells, again, we can go right to the exosomes. And the exosomes are more abundant because they come from amniotic fluid. And amniotic fluid's more abundant than an umbilical cord, for example. So the cost has come way down, and it's really competitive now, at least here in the US. So having a knee injection with stem cell-derived exosomes is an easy comparison for people. But the education's not there from the typically trained physician. And had you come to me 10 years ago, I would have said, oh, I don't know if there's an option for stem cells. I had to physically extract myself from the mouse wheel, the hamster wheel, and stop drinking this Kool-Aid in order to open my mind and see what's there. Medical education is slow to sort of catch on new things.
Yeah, that makes sense. And I'm glad that these options are becoming available. It feels like there's a lot less downtime in having these kind of treatments rather than having a major surgery, of course, for people who are going through that. So this to me sounds like something we definitely should try before we exhaust, the options and come to surgery in many cases. Now, if we're talking about joints, we're talking about cartilage, different kinds of issues around that. We talked about autoimmune. Are there any other applications for stem cells? I mean, you mentioned that you are a neurosurgeon. So are there any neurological applications for stem cells or anything exciting in that field?
We have various applications because it's expanded so rapidly. People hear you're doing stem cells and they're, oh, can you help with this? And if there's good research and I can find some literature and we can emulate the protocols, we can try. So we don't just do things randomly. We do it based on good medical evidence. But yeah, I mean, we have some cosmetic applications, microneedling. You've heard of perhaps of the vampire facial with platelet-rich plasma. Well, you're just getting a more potent dose if you do stem cells or stem cell-derived exosomes. We've done some injections in the scalp for thinning hair. It helps re-stimulate the follicles. People are sports performance. They want to shave off a couple seconds off their 400-meter dash. So we might try that. We've done people who are recovering from injuries, which is not uncommon. A lot of athletes, and we have some professional athletes that I'm not permitted to name that may have had some approaches here by us. And then we neurologically, yeah, I mean, for traumatic brain injury, the delivery method is actually IV or intranasal. You inhale them. And we have people with lung issues, chronic bronchitis. They're on oxygen. That we've done a breathing treatment with the exosomes and helped the lungs and get people off of oxygen. We've had people with chronic kidney failure. We've been able to sort of reverse some of their kidney function into a good place where they don't need dialysis. So all kinds of different things. And we now have specialty cell exosome. We were lucky enough to get our hands on some natural killer cell exosomes. And for your audience, natural killer cells are part of our normal immune system. Probably a couple percent of our white blood cells are these natural killers. They sounds bad, but they're good. They actually go around the body and they selectively remove really abnormal cells like accidental cancer cells that we do make throughout our life. And senescent cells, which are cells that have divided too many times. They're full of yuck and debris and toxins, but they haven't died. So they're taking up space and resources. These are called zombie cells for fun. They need to go. These natural killer cells go around our body and selectively remove these bad cells. They can identify them, and they do it through their own specialized exosomes. They make their own little exosomes that have these enzymes that go into the recipient bad cell and cause them to rupture and release their contents into the bloodstream where we can recycle them with the contents. You can imagine that one of the most noble things doctors can do, we all want to do, is cure cancer. So we got our hands on some of these natural killer cell exosomes, and we are helping people with cancer, sometimes with intravenous use in the IV. Sometimes we inject the tumors, and exosomes are small enough, although they'll disperse throughout the tumor, whereas if you inject stem cells, they're a little too big. And these are off the shelf. So if you say, well, I'll just use natural killer cells, I don't need the exosomes, it's very hard. You have to put them in a lab, divide them, get more of them, stimulate them. With the exosomes, you don't have to do that. It's like you don't have to train the soldier. If you've already got the gun and the ammo, you can just go and take care of the problem. We've been doing that and seeing some interesting results. And that is a really big project for us.
Wow, that is fascinating. And definitely hope to hear more good news as time progresses as to the applications. When it comes to cancer, there's a lot of suffering around that, of course, and that would be a phenomenal application for stem cells to work with. Wow. Yeah. Can we think of this as sort of a one-time treatment? So if we're doing this, let's say for an injury recovery or to avoid having a knee replacement or hip replacement, is this a one-time injection or do people have to come for a series of treatments or over some time, or how does that work?
It's typically a one-time deal. And like the literature suggests, 82% of those people at 15 years are still doing great. So now, could we get to 20 years and it drops down and maybe people need a repeat in 20 years? Perhaps. But this is a long-term, meant to be help your body repair something like you were a young person. Because if you're a kid and you hurt your knee, you're going to heal it. You're made up of so many stem cells. We want to bring back that youthful, restorative healing, that reparative cell activity. And sometimes it's a one and done. In fact, most of the time it's a one and done. Now, for a different type of injury, like a brain injury, recovering from a heart attack or stroke, we usually do one IV and we see what happens. And if it moves the needle in the right direction, but they're still not all the way where they'd like to be, then maybe we try another one. Everyone is individualized. We don't have a one size fits all. That's part of the sick care system. We're getting away from that.
Yes, very true. And are there any risks to wanting to work with stem cells in our own bodies, or seeing that they likely will come from a different person with a different DNA? And are there any risks to having those injected?
Well, we always wonder about the DNA from other people, which is really nice when using the exosomes because they have really no significant DNA. They have a few fragments, but you're not going to change your genome from that. But generally, no, we haven't seen any risks. Some people do. If they get an IV, they have like a 1 or 2 day response where they might have a slight reaction, a low grade fever or flu like symptoms. We rarely see that with the exosomes. I believe that's when you flip over the cell machinery from inflammation to the opposite. Some of those cells have stored up a bunch of pro-inflammatory proteins and cytokines and like histamines and things like that, like that are on the ready. And that when you flip over the machinery, the factory, the storerooms have to clear out the inventory. So that has to get released into the bloodstream. And then you get this sort of inflamed feeling for a day or two as you release that. And that's just part of the process. But in terms of real risks, there's always risk of pain from the injection or something like that. But most of the injection pain is gone within a few days.
Yeah, it sounds like, in comparison to surgery, actually a fairly safe procedure or treatment to have, considering back surgery or replacement surgeries. So,
Much fewer risks for
yeah.
sure.
Yeah, wow. Now, if our listeners are curious about what we have talked about and they would like to find out more, or they would like to connect, or maybe they are somewhere where they would like to try some of these treatments, where can they find out more information? And what's the process behind? Do you have to be referred by your medical doctor? Or how do people in the US connect if they would like to have stem cell treatment?
Well, not all of our patients are in the US, Petra, so I don't want to be so limited and stick my head in the sand like most people from the US who don't even know geography. But we start remotely. So we meet people. We have a virtual meeting like you and I are doing here by video. And for those of you listening to this broadcast later by audio, you don't get to enjoy Petra and I looking at each other while we're recording this. But we do video, we receive all the records, we review them, we have a meeting or 2 or 3. If someone needs a test, lab test, or an MRI, and we're very picky about how those are done, then we can help order them, and then we can receive them electronically and then review them and share my screen and show people the imaging. We only invite them here to our clinic if we think we can help them and we've sort of done all the hard work ahead of time, because the actual injection is the easy part. And then people can have time to plan their travel here to Las Vegas, Nevada, USA. There are lots of flights. I know you can catch some direct flights from Europe mainland and British Isles. And spent a little time here. We've treated other folks from Europe and other continents. In fact, I'd say the minority of our patients are actually local to me.
Yeah. Are there any resources as far as finding out a little bit more about maybe some of the studies or some of the work that's been done around and with stem cells? Any resources that our listeners can look at?
Yeah, totally. So the best way is connect with us, and I'll see exactly what you're interested in to send you the specific articles that I draw upon, depending on what you're dealing with. You can look up Dr. Hernigou, Hernigou. We follow his joint methodology for the most part, and he's published. You can find him online. Look for his 15-year study on knees. He also has some wonderful studies in hip osteonecrosis, where the bone marrow in the hip dies and people have to have hip replacements. Well, he's been able to inject stem cells into the bone marrow there and reanimate the hip and save it. So we do lots of things like that. So you could see him as well. We have a website. Our company is called ReCELLebrate because we are celebrating the renewal of your cells the way it should be. And that's spelled ReCELLebrate. And you can find us at ReCELLebrate.com. We're on all the social channels with that same name. And as far as I know, we're the only people using that word with that spelling. So you should be able to find us readily. And feel free to reach out to us, ask any questions. I love new things to look up. I'm a nerd. By the way, I'm wired and in my bloodstream. So we like to help people with different types of issues. And even if it's the first time.
Amazing. Thank you for sharing all that. And we, of course, will be linking to Dr. Jeff's offerings in the show notes as well. And we'll make sure to connect you to his website, the social, some of the resources that he just mentioned, so that you can find out some more information if you're curious, if this episode has made you curious, and if there's something that you were thinking could benefit from having a stem cell treatment. This would be a good time to find out more, maybe connect with Dr. Jeff and his team to find out if that's something that could be helped with stem cells. And as always, if you do connect with Dr. Jeff and you have some treatments, let us know your experience. Let us know what happens. I always love the magic that happens when our listeners connect up with our podcast guests, and something usually happens afterwards that creates a really unique and magical experience. So let us know, join us on the socials, and let us know what your experience has been like. I definitely want to hear more about stem cells and how our listeners are finding their journey with those. So thank you, Dr. Jeff, for joining me today, shedding some light on this little bit mystical thing that has, I'm guessing, also a few myths around it and things that aren't quite true that we definitely spoke about today. So thank you for that. Thank you for being here and for spending your time with us today.
My absolute pleasure. Thank you so much.
Yeah, and hopefully we'll hear some really good stories coming out of the stem cell world from our listeners, from Dr. Jeff and his team. And thanks everyone for tuning in today. Thank you again, Dr. Jeff, and take really good care of yourself.
Same back.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejōrni.com. Sending you love and courage, and see you next time.